Hi guys, I'm Dr. Joanne Michelle Martin, a physical therapist specializing in pelvic health therapy. I'm the owner of JMM Health Solutions, and tonight we featured a Facebook Live with Dr. Janelle, well, soon to be Dr. Janelle Chase Mayer. She's currently a PhD student in psychology, but a practicing creative systems therapist. Janelle was there to share with us as we spoke about the psychosocial effects of pelvic floor dysfunction. Unfortunately, we had some technical errors or technical glitches on Facebook, and so we've had to clean the video up some, but nonetheless, we've got all the information here for you. Feel free to contact either myself or Janelle. She can be reached on Facebook or Instagram at JC Mayers, and you guys know where to reach me at the JMM Health Solutions page, via email, via phone. All my information is there, but feel free to reach out to us either for feedback with regards to the content from tonight's video, or also if there's other information that you guys would love to have or other things you would love for us to talk about. So I hope you do enjoy this video. It runs just under an hour. It's broken up into 3 parts, so you don't have to sit there the entire time and watch it, but I certainly do hope that you enjoy it, and we look forward to being able to give you more great content. Thank you.
So while we wait on Janelle Mayer on, I will just, reintroduce myself. I'm Michelle Martin, physical therapist, pelvic floor therapist, and I work primarily with pregnant and postpartum women. I also do see children for pelvic floor dysfunction, so bedwetting, incontinence, working with moms with incontinence, postpartum, trauma, injuries, that type of stuff. So tonight, we're coming on here to talk about the psychosocial effects of pelvic floor dysfunction. And it's huge. It's really, really huge. There's so much that women go through, especially, and I'll speak just in this broadcast specifically to women. There's so much that women go through, and it's still not a common thing. So oftentimes, I speak with women and they're like, well, I was trying to explain it to my physician, and they said it's fine, it's normal, or family member will tell them, hey, it's normal, especially things like leaking after pregnancy, pain, that type of stuff. And so most women just kind of grin and bear. And really and truly, that shouldn't be. That we really want for women to be heard. We really want to be able to help people and make a change and that type of stuff. So I think, here we go. Let me go ahead and add. There we go. I'm going to try to add Janelle here. So Janelle, if you are on already, just go ahead. My phone seems to be acting up. I don't know why. Me and technology, we just do not seem to work really, really well. I'll go ahead and wave. Go ahead and you can request to be added. Let's see. I'm trying to add viewers here, but it wouldn't let me add. Still not letting me add. But anyway, like I was saying, we really want women to be heard, and oftentimes what research is showing us and what other clinicians' experiences are is that women are going as many as to 6, 7, 8 even appointments with different specialists, when they're having issues with pelvic pain, before someone says, here's what's going on. A lot of times women are told, it's all in your head. They're told, don't worry about it, that's normal. But when women are facing this much pain, when women are having these issues, you just can't look at someone who's suffering, who's in pain, who's missing time off of work. If they're a teenager, they're missing time from school, or, a young adult from college, or whatever have you, and you're telling them, oh, you'll be fine, just kind of that type of stuff. So I'm hoping that with this, I'll be able to really, just kind of shine a light on what's going on specifically with pelvic health disorders, and try to educate you guys some more. So let's try again to add here. Trying to add. All right, guys, if you give me 1 second. I will go ahead and try to add Janelle. All right, JC, I'm not sure why this is not letting me add you, so we'll try this again. Might be working now. Fingers crossed. There we go. Beautiful. Let's see if I can add you now. Still won't let me add you, but I've tagged. All right, guys, I apologize for the tech difficulties. I'm going to try to see if I can get her, and I will be right back. Oh, there we go. Perfect. And we're adding. I'm trying to get this light out of my face so that, there we go. That's a little bit better. And according to my phone, we are still adding people. You have to love technology. Just have to love it. All right, let's try again.
Yay! Yay! We did it! It only took like what? 5
Get on.
All right, guys. So without further ado, let me introduce you. This is Janelle Mayers. She is a friend, a sister, a colleague, an advocate in the fight for mental health, for fitness. She is a coach, a CrossFit instructor. I mean, just telling you all the things that she is might take the whole 30 minutes. Yeah. She is a nutrition specialist. She is a PhD student. She is a go-getter, super mom, achiever. I mean, you name it, she's it. So welcome, welcome, welcome.
Thank you, honey. How are you doing?
I am well, thank you. I am well. Slightly tired, still got scrubs on, but
yeah, I realized that you have on your scrubs, and I just came home from the gym because we're doing a CrossFit work competition.
Nice.
So yeah, I just had training, so I just rushed home, put on shirt, and yeah, let's get this show on.
Let's get this show on the road. So tell the viewers a little bit more about yourself. I'll let you tell them.
Okay, so as Juan said, I'm actually just trying to invite some people on my page. Let's start with, I think, what defines me the most. I am a mental health consultant. I'm a trained mental health consultant. So my specialty, I would say, is connecting dots, creative systemic therapies, where we're looking at how all the systems work collectively together to get us the best health. Now, my background is really, I worked in a rehabilitation center for over 12 years, and one of the things that I recognize is that you can't leave one thing without the other. And for me, that's why I do so many things. People always ask why you do so many things, but the body is such a beautiful structure that you can't leave the brain out without, you can't leave out your body without your.
Uh-oh, I think we froze.
I think we froze. So we're a bit frozen. So we'll wait for her to come back here in just a second. And she is truly a wealth of knowledge, which is the reason why I wanted to have her on here. Hopefully she's not frozen for too long. You know, the body is such an incredible machine. Let's bring her back on because I think she got knocked off. The body is such an incredible machine, and we really, really need to consider the body.
So I'm back on.
One area.
I'm not sure what happened there.
That's okay.
Yeah. Okay, I think when I was trying to share our life, something happened. Right. So as I was saying before, one of the things that I realized is that we all have to work, everything on us works together for a more effective running. And that's why I do so many things. Because as human beings, we're taught ultimately, you know, you need to be the best this and nothing else. And I realized that from working in my box, actually, shout out CrossFit 246, that people would not understand the importance of going to an osteopath or a physical therapist or a massage therapist even before they got to a point of going to surgery. They would either just stop and they come to me. A lot of people come into, I tell physical therapists and sports med doctors, the reason why so many people are referred to you guys is because coaches actually take the time to say, look, there's something wrong happening. You need to go get it checked out. And so for me, I think it's helping people to see an integrative approach to their health and their wellness rather than just a one-sided approach. That's me in a nutshell in terms of all the 51 million things that I do, from grief recovery, mental health consultancy, marriage and family therapy, sports and exercise nutrition. We are the sum of all those experiences. So I think the more we are educated about it, for ourselves, the better we can actually function within ourselves and also give the best to our families or our friends or whoever else come into contact with us.
Absolutely, absolutely. So the talk for tonight is the psychosocial effects of pelvic floor dysfunction. And like I was saying earlier before you jumped on, you know, traditionally women have been told, you know, if you've got a problem, you kind of keep it to yourself, you kind of keep it bottled in. You know, research has shown that a lot of women who are having problems are going to 6, 7, even 8 clinicians before they're diagnosed appropriately with an issue, before they can actually get the treatment that they need. And what that kind of leads into is it becomes a very huge expense. And, you know, if you don't know what's wrong with you and you don't know how to attack it, you know, that leads to anxiety, it leads to all these other things. So I wanted to speak to you a little bit about that. I wrote down some stats while I was getting ready about the different things societally that, you know, different numbers that really come into play with pelvic health issues. For instance, with endometriosis, it's linked to depression. Research is showing that at least 59% of patients with endo have some type of psych disorder.
Yes.
You know, endo polycystic ovarian syndrome, or PCOS, is linked to infertility issues, which is another costly thing because you think of, I'm not sure what it is in Barbados because I haven't lived at home for so long, but here in the US, the average person is spending about 20 grand trying to get pregnant, you know, which may or may not be successful. I've had a patient in the past who, thankfully, on her last attempt, you know, she was able to conceive, but she'd had several failed attempts before. And she was like, I've always wanted a child. And we literally cleaned out our savings.
Yep.
You know, she was like, we spent about $30,000, $40,000 on just me trying to get pregnant. And by the time she got pregnant, and this was over years, by the time she got pregnant, she was almost 40.
Yep.
So now she's a high risk pregnancy, more monitoring, you know, that type of stuff. As far as leaking and incontinence goes, you're looking at least $19.5 billion just to cope with incontinence, and even more just for the treatment, the doctors, and just the time off of work. Pelvic organ prolapse. The cost for Medicare in 2006 was reported to be about $412 million. Wow. And I also, with a lot of pregnant and postpartum populations, so you're talking about pain, and you're talking about some of the issues that they deal with, you know, if they're coming off of a C-section, if they've had any significant trauma, if they have a bad experience, you know, with regards to the clinicians who are working with them during the pregnancy, if they've got incontinence, if they've got delayed healing or anything else going on postpartum as a result of the pregnancy, you know, all these things have been linked to increased anxiety and increased depression. And then you've got our youth athletes, which nobody talks about because they're supposed to be healthy, they're supposed to be strong. But what they're realizing now is you've got an even higher population of reported cases, and this probably isn't even all, of youth athletes with incontinence issues. So you've got teen girls, middle school, high school, you know, gymnasts, track and field athletes, volleyball players, what have you, who are reporting incontinence, or they're having pelvic pain, or they're having undiagnosed endometriosis, and they're having to deal with this, you know, where the parents may not be aware what's going on. They haven't found the appropriate physician. So, I mean, I guess we can dive right in and talk about all these things from your perspective as a mental health consultant.
Okay, so yeah, so you raised the first point you raised about PCOS and endometriosis. I just did a talk, Dr. Damien Best of OB/GYN Total Care in Barbados. He is one of, I believe, fertility specialists in Barbados, as well as he does a lot of work with endometriosis patients. And we were talking about that, you know, what are the mental health aspects? So I don't like to dive right into the concept of mental disorders for a couple of reasons. Because we have people who are experiencing some trauma associated with the information that they're finding out. And so therefore, what happens is that people have a lot of isolation. And so with isolation comes the increase of anxiety or inability to actually process the information. So a lot of women will report that if they had someone to talk to, they will actually be able to manage it. But as females, we are not taught, and the point you talked about athletes, I'll stick a pin in that because I was talking to a sports med doctor who talks about the fact that, you know, we don't even think about athletes and sexual transmitted diseases. And if you live on, you know, and you live on a college campus, I mean, that's rampant. But that means that we're not tapping into what their sexual health is as well too, right? But I like to look at the concept that the mental health conversation it's missing. So I talked about this at the conference where we give them information basically, and we just give them a medical terminology, and we don't necessarily ask them to explore how that is actually impacting on their psyche. And so if you are like me, if you tell me something and I don't have a good relationship with the doctor, I'm going to be like, I'm not coming back, right? But if you have a good relationship with your doctor and your doctor says, well, you know, here's this information, I want you to go back home, review it, share it with somebody else, and then come back to me and let's have a conversation, not necessarily of the diagnosis, but how you're feeling as a result of hearing the diagnosis. So I think that's what accounts for that 59% of people experiencing some type of mental health, leading towards a mental health disorder. I don't like to call it that so quickly because sometimes that's not what it is. Sometimes it's just people's inability to manage the information that they're getting. I talked about, at the conference, I talked about something like I had to get amniocentesis. And like anybody who knows what it is, having a needle go down your stomach while there's a baby inside can pretty much, to draw fluid, to a doctor seems like a regular procedure. To me, it's scary as hell. So what are the conversations that we're actually having, you know, with our female clients about how this is impacting their ability to even think, to act, to feel? And I think once we begin to have that conversation, then we can actually reduce the likelihood of them actually getting some type of mental health disorder. I struggle with how quickly we diagnose them because we haven't given people a chance to even come and talk to you or talk to a nurse who may be au fait with, you know, okay, you have this issue, you have this pelvic floor issue, this diagnosis, but the literature says that if we do X, Y, Z and we take care of this particular component, you will get the results. So.
Right. And that's a really interesting point, and it's something that I was trying to tag one of my mentors here, Jerry Durham. He is a well-known physical therapist in the U.S., and his specialty is educating about the patient experience.
Yeah.
And I feel, especially for women's health issues, it is critical. It is absolutely critical that we really have a much more refined approach to how we treat these women. Really listen to, not only just listen to what they're saying, but really hear them and be able to explain stuff to them. You know, the vast majority of clinicians automatically assume because they know that the rest of the world knows. And I tell people all the time, if a patient leaves you and cannot explain or cannot tell somebody else what is wrong with them, you have done a bad job of educating them. And even more recently, I had a patient, a client from Barbados also reach out to me with regards to an issue where she went to the physician and she hadn't seen him before for this issue. And he did a test followed by telling her she needs a hysterectomy. And the problem with that I found is when the client reached out to me, you know, she still didn't know what the diagnosis was. You know, she's asking me, well, what is this? I don't understand. Why would they need to take out my uterus? Why would they need to do this? You know, and for her, I don't think it was as much as being totally against whatever the recommendation was, but she's not able to make a fully informed decision because she has no idea. So now she's like completely stressed out. So now you've caused this woman increased anxiety, probably raised her blood pressure and everything because she just doesn't understand.
Yeah, I think what is also something that we need to look at is that vaginal health is also mental health. And we don't have a conversation about vaginal health, we have a conversation about vaginal illness. So as a young girls, we don't go to the gynecologist because, you know, we're just checking to see if our vaginas look the right way, smell the right way. We go because there's a problem. Either we have bad periods or somebody might have a first painful sexual encounter. Whatever it is never because it is for a checkup.
Right.
And so we're
even with adults. Even with adults, with grown women, you've got women who don't go.
Exactly.
Or rather, the only time they go is not preventative. It's usually, I gotta have this problem.
Exactly. So therefore, when we think about the vaginal health, we're not even including the mental health aspect of it. Like I always tell people, like, the vagina has a lot of parts. If you can't have a conversation with me about all those parts, and now if you can't have a conversation about pelvic floor health, we were talking about this, and I was asking my class, do men have pelvises? And everybody paused. Do they? Do they? And I said, even that leaves us at the back end of even understanding how our pelvic health impacts our mental health. Because you're always going to be wondering what is wrong with me. People who, I had a girlfriend today, we were talking about, you know, the fact that she has to go on and she has to pee before every exercise. And think about something like that, that we can easily look at how that impacts our mental health, but we can also look at physiologically, how can you change that by doing certain exercises. Now, if we talked about it from a perspective of just mental health and preventative, then people's understanding and ability to deal with it would be so much easier. But our first experience of our sexual health or our vaginal health or our penile health, for to include men in this conversation, is always through a traumatic experience or experience where you're always trying to find out. And if we're coming from that place, it's going to put us in the back burner or trying to actually be healthy in a space that pretty much your vaginal health and your penile health needs to be the two things. That, along with your brain, those two things, plus your gut, and then we can add all the other stuff, those things need to be operating right all the time.
Yes.
Right? So there's less trauma in the body, and the body doesn't have to be always finding a way to purge or finding a way for it to actually be working effectively. Because if you can't urinate or you can't excrete, we're going to got some issues.
Yep, absolutely. And so one of the things, I mean, when we talk about pelvic health, like I always tell people when I'm educating them about the pelvic floor, is your pelvis. I mean, if you consider it like a bowl, I think most people might know anatomically what the pelvis, the bony structure of the pelvis looks like.
Yeah.
And then those muscles actually sit in there. You've got multiple layers of muscles. You've got the muscles responsible for sexual encounters and sexuality, that help with orgasm, that help with erection, those types of things. Then you've got the muscles, the deeper pelvic floor muscles that really function as a supportive aspect. They function to help stabilize the body. They're anticipatory muscles that work to help stabilize you when the other muscles are active. They help to maintain intra-abdominal pressure. They help to work with the intra-abdominal pressure for continence. And you think about, you know, so when you actually start thinking about pelvic health for what it is, you're talking about sex, you're talking about the ability to urinate, you're talking about the ability to defecate. And then, like you said before, we really, really need to include gut health in that, because right above the pelvis is the intestines and your stomach.
Exactly.
And we really, and funny enough, like I tell a lot of my parents of pediatric clients, more often than not, when these kids are having issues with incontinence or bedwetting or whatever have you, I am pretty sure that like 90% of the time is because they're constipated.
Yeah.
You know, their nutrition is poor, they're constipated, and so you've got issues. You've got all that feces in the rectum pressing against the bladder and so on. And so, I mean, really and truly, we really need to consider all that stuff. And like I tell people all the time too, if you walk in a room and you can't say pee, poop, and sex without being embarrassed, that's a problem.
Yeah.
Because we all do it. We all do it. But it's still the thing that eludes everybody, in the sense of nobody wants to talk about it.
Yeah.
It's something everybody does, but nobody wants to talk about it.
Hi, Hiru. So Hiru is a, I'm just waving to our crowd. Hiru is a, I don't want to get your title wrong, but he's my magic herbalist. So either you're talking the whole concept of constipation, and I went, like, y'all know me, I can tell my story. But I went to Hiru actually for my challenges that I had. I had some ovarian cysts. I had some dermoid cysts that were actually wrapped around my ovary. And I went to Hiru and we did a whole routine that helped me to be less constipated, as you talked about, right? But also in terms of just my vaginal health. And me and Hiru had this conversation about that you're not supposed to, a wellness consultant, right? You're not even supposed to have painful periods. And
No,
how painful periods are actually directly linked to your pelvic health. And so that's one of the things, that's why I said, like, our first experiences, as I remember growing up and being in so much pain with my period, or vomiting, you know, on my first day, right? And a lot of these things that are young females, right, our experiences are because we are not well educated about our pelvic health, our vaginal health, our gut health, right? And that's why my thing is always, so I don't like to stress then for it going straight to a disorder, because if we take the time to teach people, and the research is there, if we take the time to teach people preventive measures, people will do better in making changes that will help them to actually create more healthy options in their life. Because that's what ends up happening. When people go to a crisis element, that's what happens. The doctor says then, well, the more informed doctor, the more informed medical consultant says that, you know, hey, this is what we need to do. You know, let's take a step back. Let's look at how we didn't do it before, and let's start to begin to add these little things in. Let's do these exercises. And no, it's not just doing Kegel exercises, people. There are a lot more things, but again, Kegels are the only things that are out there, you know? That's the only thing that people know. And so therefore, if they do Kegels, then the anxiety increases, because in their head, it's like, I've tried everything, which is the only thing that they know that really they don't really need to be doing, but because that's all that's been offered, or that's the only set of information that's out there, they grab onto it. And then you will hear, well, I've tried everything and it has not worked.
Yeah. And the funny thing is that we also have a lot of evidence to support that the vast majority of people for whom Kegels have been recommended, they've been doing them incorrectly. You know, so oftentimes a woman will go to the gynecologist and they'll say, oh, you'll be fine, just do some Kegels. Well, what exactly am I doing? And like I tell people all the time with regards to, or for instance, my clients, you know, I've had patients say, well, I did Kegels and it didn't work. I said, well, what position are you doing your Kegels in? Well, my doctor had me doing them lying down. I said, but are you lying down during the day? You know, your pelvic floor muscles are made up of a combination of slow twitch and fast twitch fibers. You know, slow twitch meaning you need them for endurance. Fast twitch means you need them to turn on really quickly. You know, you look at a sprinter and you think, you know, they start out of the blocks and they start off, it's a little bit slower, but they've got those fast twitch muscle fibers to kick in. You've got to train both of them. You've got to train them in different positions. You've got to train the speed. You've got to train the endurance, because your pelvic floor muscles are so much more than contract, relax, contract, relax. You know, it's so much more than that. And then again, with the nutrition, I actually have a video, an interview that I did with a really awesome clinician. She's a naturopath, and we talked a lot about gut health. And, you know, we think about the things that people are eating nowadays, the processed foods and all the crap, fast food and you know, the dairy, heavy dairy. And I don't even so much mind dairy for those who can tolerate it. A lot of people can't. But again, you know, you think of a lot of the processed foods that people are eating. They're not eating whole food. They're not eating, you know, fruits. They're not eating vegetables. It's amazing how many times I look at people and say, okay, if you can do these two things, eat fruits and veggies and drink water, that'll be half of your solution right there. People are like, I drink water in my tea, in my coffee. I drink sparkling water. No, you don't need sparkling water. You need water. So, I mean, it's amazing the things that people, you know, the complaints that people have. And like you said, a lot of this can be affected before it becomes something more critical.
And I also want to talk, this has been my buzzword for the week, so I won't use it. I want to talk about the narratives that we have with the diagnosis that are most popular, because I'll use the word popular because that's pretty much immediately where people go. So you do something like PCOS or endometriosis, or what's a relatively popular gynecological
incontinence.
Incontinence. And I think part of it too is a lot of people are creating stories surrounding these diagnoses without getting relevant information. So when you look at something like Dr. Google, which will say, if you have all these symptoms, fibroids, thanks. If you have all these symptoms, you can potentially have this. And so then what a lot of women I find are doing are self-diagnosing, and then they're creating anxious thought processes surrounding the self-diagnosis. So like the little post that we did, you saw how many people afterwards started to comment on what they think is potentially wrong with them. And so therefore, if you never go and get information or seek a source, right? And you don't always have to go from a medical source, because my thing is I went both. I went to Hiru, that got clarity for me, but I also went to my medical doctor and that got clarity for me. And a lot of people are afraid to get clarity. So therefore, you have somebody who has been having symptomology for 6 to 12 months prior to going. And we were talking about this at the conference. How does somebody have a fibroid at the age of 20-something, the size of 2 grapefruits? It doesn't happen overnight. So it means something is happening. Something is happening that we're not paying attention to, or if we do pay attention to, we're like, you know what, I'm not going to deal with that. That's just like I can pray that one away, right? I think that's all. I think that's what also adds to poor mental health. And so by the time they actually get to the doctor, you're now dealing with a poor psychological construct of what it is that you have, and then you add the physiological aspect of it. It's only obvious that, you know, you're going to end up with something, and it is going to be difficult then to deal with the treatment. So therefore, then people don't want to deal with the treatment. You know, there'll be people like, okay, you know, whatever happens, happens. I'll be fine. You know, I live a good life. So I think we also have to look at that as well too. Like, why do we continuously ignore our symptomology? And perhaps is that we don't know what our symptomology is, or if we have too much information from Dr. Google, and I think Dr. Google has a lot to do with the way in which we interact with our bodies. You know, are we willing to have a second opinion after we found out from Dr. Google?
Right.
And she says so true. Samantha says absolutely.
Yeah, and you know the funny thing is we had a joke because most of the diagnoses on Google usually ended up with cancer. So I think if a lot of people are looking at Google as their source and they think ultimately, oh God, I've got cancer, you know, it already, I mean, psychologically, they feel doomed.
Yeah.
You know, they feel like, okay, it's over. But one of the other things too that I think is so important, you know, in that whole concept of why people are not being checked, and we look at the social aspects, one of the big factors that plays into the financial and economic increase and impact of pelvic floor dysfunction is time off work. You know, I've heard so many people say, oh my God, well, I can't take time off and I don't have the time. And, you know, or you've got women after pregnancy. Here in the US, we don't really have maternity leave. You're blessed if you have a company that offers it. You're blessed if you are in a position to take time off. Like with my daughter, I stayed home for 6 months. I wanted to do that. We prepared for that. I stayed home with my daughter because I felt like that was something that was important to me. Now with my son, it was about 4 or 5. But you've got women who go back to work 2 weeks after having a baby.
Yeah.
Or a week after having a baby, you know, because they don't have time. Their jobs aren't offering time. They don't have, they're in financial constraints. And so that in itself can lend to a lot of the issues that they're having from an anxiety perspective and so on.
You're absolutely right. Because let's take, bless our childbirth. And I did the whole natural childbirth aspect. But let's take somebody who has just done the most power producing event that a human being can do, and give them 2 weeks to return back to work, right? As you very well know, the body can be thrown out of alignment. Also, the hormones that we are producing at that time may very well not be the best thing for our mental health versus it's actually provided for our maternal health. So our brain is producing the hormones that says produce the milk so you can connect with your baby, not produce the milk so you could go back into work and have to deal with the day-to-day constraints of sitting for long periods or doing heavy lifting or even experiencing brain, because you will very well know our brains function a little different when we're pregnant.
Absolutely.
We don't remember a lot, and that's not by because we're forgetful. It's because we're feeding another human being that require the same nutrients that are going to the nutrients that are going to our babies are not necessarily going to the same parts of our brain that are facilitating certain things like our memory, our cognition, all of that stuff. So you take that and you put it into a pelvic floor challenges. People are going to have some mental health issues there, you know. People are going to think like if they're losing their minds. People, I mean, I know you do a lot in terms of talking about postpartum depression. And one of the things about postpartum depression that I think is missed by a lot of clinicians is the mental state of the mother prior to the pregnancy. So we made this assumption that people was just hunky-dory before they got pregnant. We make the assumption that people have beautiful pregnancies, right? And so therefore then we hold on to the label very strongly. But I think people also have to do very strong mental health checks before, during, and after. So you can get people in a frame of mind like, look, your mental faculties are completely different when you are pregnant versus when you are no longer pregnant. You're not the same person thinking, you know. That's like us. We can have this conversation and we probably will be so much clearer at like 8 o'clock in the morning when we have not had a whole entire day of working and running around with our children and exercising. But because we have a capacity to actually thrive under pressure, we can do this. But there are some mothers who can't. You know, that at 8:30, I'm like, oh my gosh, I'm so overwhelmed. No, we'll have to cancel the whole thing. So I think we have to be mindful of that too when we are labeling our psychosocial effects and not necessarily allowing people to grab so much into the disorder. Because what I find with once you give somebody a disorder and you don't give them an opportunity to reorder their life, they hold on to that disorder.
Yeah.
You know? And then they will say stuff like, I have incontinence. I'm incontinent for the rest of my life. You know, I got depression associated with that. And it's like, no, that does it make sense for your body to be in a state of incontinence at this time? You know, maybe at 2 weeks you went back out to work. You didn't have the support. Hiru was talking about sisterhood support, community groups will help. Definitely. Yeah. So, I mean, these are things that I think before we go straight to that aspect of a disorder, are we even looking at how the order occurred? Do people even get an opportunity to say to you as a clinician, as a doctor, look, before I was pregnant, this is all the shit, and y'all know I cuss bad, that was going on in my life, And now on top of that, I have to raise this child with that other circumstance and deal with maybe the fibroids that I've been having my whole entire life that you didn't pull out when I told you to, there's so many other things that could so impact our mental health that puts us in a state of angst. Yes, it is anxiety because we're thinking about what the future holds, but almost the ability to live our day-to-day lives. And just get up and do and function well. Because my thing is, I don't want people to just function. I want people to function well.
Absolutely. And one of the funny things is that with a lot of doctors, I mean, if you find a great clinician, that's a blessing. Because with a lot of, in the traditional medical model, majority of doctors, you come in, you tell them what's going on, and the first thing they say is, you need to take this.
Yes.
Without saying, let's try these measures first. Let's try, what's been going on in your life. Let's try to see if we can mediate the stress. Let's try to see if we can, have help. Let's try to see if we can, maybe try these therapies, whatever have you, as a first step. It's usually always pharmaceutical, and nowadays more so than even before. And that's not good because then, fast forward, you've got people now on so many drugs because they're taking drugs for the side effects of the drugs that they were given in the first place.
Yeah.
And one of the biggest issues in this country now is the opioid epidemic. And you've got physicians, even gynecologists, prescribing opioids at an increased rate, according to research, for non-surgical pelvic floor issues, for chronic pelvic pain. You've got them given, outside of a C-section and outside of a surgery, like say a hysterectomy, you have got physicians, when women come in complaining of pain, the first line of defense is, take this, and you're giving them narcs. Why are you giving them narcotics?
Yeah.
And that's going to cause constipation because narcotics is well known to cause constipation. And so now they're constipated on top of whatever other pelvic floor issue they've got going on. And so now we're adding insult to injury, and you're wondering why they're not getting better. They're wondering why they're not getting better. And on the cycle continues.
Yes. Sam actually has this. Yeah, my doctor told me to take antidepressants while I was pregnant because I was in an emotional abusive relationship. I obviously refused, but it was crazy to her. And I think, like you said, that's such the norm. And I think the more and more we talk about
there, come on back. But again, you know, we talked about a lot of different things. We talked about social implications, people who are missing time off of work. You know, I don't know where everybody is from that was listening to this broadcast. I'm not sure. But, you know, when we look at, you know, different countries and what they offer in terms of, let's say, for instance, maternity leave, it's really, really pitiful. You know, for instance, I have a really awesome friend who lives in Sweden, and they get 1.5 years after giving birth. Here in the U.S., you know, you get your job is kept for up to 12 weeks. That's a federal mandate, but that's only in place if your company has over a certain number of employees, and I believe that number is 50. So if you're talking about working for a small business, you don't have that luxury. Add to that the fact that a lot of people don't have vacation time, you know, based on, or may not have vacation time, I should say. You know, it depends on how your vacation is issued, whether it's accrued, whether you just get a flat sum of days at the beginning of the year or the beginning of a period. And so they may only have those days and they may have to go back. And for instance, for something like pelvic organ prolapse, you know, there are a lot of cases of prolapse that aren't necessarily caused at birth, but we're finding more often that because of certain poor strategies, poor techniques, just poor body awareness, a lot of women are then developing pelvic organ prolapse postpartum. And so you're thinking, what if these women have to go back to work in an environment where they're having to lift a substantial amount? Or what if these women are, you know, what if it's a single mom of multiples? What if, you know, what if you've got all these different things going on? What do we do? So it's really, you know, a lot of people don't have that luxury. And that's something very important to consider that can add to a lot of the stress and the anxiety postpartum for these women. But a lot of these issues sometimes can be developed as we gradually get away from that specific incident of childbirth, you know, in the weeks and, you know, following. Oh, we're back. Woo!
we're back. Technology will do it. Won't we do it?
We broke Facebook.
Yeah. And share, guys. If you like what we're talking about, do share. I forgot to comment and say that, so we can get more people. Yeah, I got hot. So I was listening to you as you were talking about the fact that people had to, you know, still lift and all that stuff. So I'll listen to you.
I mean, you know, you think about people, you think about nowadays, you know, the mandate is when we were little, we didn't have car seats. I don't even know how many people, you know, drove. You just put the baby in your lap and you got in the car and somebody drove you somewhere. But nowadays, you know, car seats are mandatory with the baby. Those things are not light. So you're talking about lifting sometimes up to 20 pounds for a car seat, and you've got the baby in it, and you're looking at poor body mechanics, which they may already start off with poor body mechanics, but now what happens at the end of the day when they're tired? Hey, Howie, what's up, buddy? You know, what about their body mechanics now when it's the end of the day and they're tired or they've been to doctor's appointments all day? You know, what about the single mom, the single parent that's having to deal with a child without a support system, and so her body is exhausted? And you already know if her body is exhausted, her nutrition is going to suck. Exactly. The vast majority of postpartum women are probably nutritionally deficient because they're tired. And unless you have really pre-planned very well, or you have a really awesome support system, then you're definitely not getting the nutritional needs there. And that's going to lead to a lot of the other things, you know, that's going to add to the fatigue, that's going to add to the brain fog, that's going to add to the pain, because now you don't have the nutritional input to help you to heal adequately. So, I mean, there's so many factors there that really can play such a big role in all of this.
So that's a beautiful point, Drew, in terms of, I think, and we didn't delve into it, but anything that's psychosocial is actually nutritionally based. And a lot of when you think about developing mental health, people have limited capacities to have proper mental health because they're not having the proper nutrition.
We're definitely going to be doing a part 2 to this, because the biggest thing with all this information is, we really want people to be aware of what's going on. We really want people to know that there's information out there. It's really sad that people oftentimes feel that they don't have any alternatives. It's really sad when people feel that they don't have any hope and any solution. And what more
somebody's hope and somebody's ability to just push through a situation. And so we definitely don't want that. So again, if you've seen this information, if you know people who can benefit from it, we definitely want you to go ahead and share, because this is really, really important stuff. All too often, pelvic floor issues go undiagnosed, pelvic floor issues go unheard, complaints go unheard, people go untreated, and there is help out there. Hey Jay, sorry about that.
Yeah, that's okay.
I need a new phone.
And thanks to the people who keep jumping back on with us every time we get bumped off, but people know how this is.
I think the next time, for round 2, we're going to do a Zoom conference. Okay. I think that might be better.
And then get people just to sign up early. Yeah, that can work.
Yeah.
So let's wrap up in like 5 minutes so people, you will try YouTube, Damien, yeah. Well, I think this is a great start to the conversation. For me, my whole thing is being able to change narratives, because I think people just do what they're doing because there's no new narrative. When we actually start to look at how we can begin doing something different with what we currently have, I think we will get better results. You guys do a fantastic job in terms of creating new solutions for people. And I think the challenge with that is that only people who are in your circle know about you. And so therefore, people then continue to do the same old thing, like something like as you were sharing about hysterectomies. And at the conference, I learned there's so many other things you could do, non-invasive surgeries for hysterectomies and, all that stuff. So how we continue to, I think medicine is not only about crisis, it's about education. And the more education we give people, not Dr. Google, but the more information that we give, and even if it is just 30 minutes every 2 weeks, that 30 minutes every 2 weeks gives your clients or gives the general population a better picture of how to actually deal with their health. Versus being sick and then trying to figure out what it is that we are going to actually be trying to do without the knowledge. Because that's where the mental health construct also gets cloudy. Because it means that you are trying to do everything on your own when you actually have people more skilled than you. If I need to know any information about pelvic health, I'm not going to be like, oh, I know everything. I'm like, no, you need to go ask John. Have you answered yet? Or let me ask a question for you and see. So I think it's also allowing people to connect the dots as well, too.
Absolutely, absolutely. And like you said, I really think we need to have a part 2 to this because, like I said, among the many things that Janelle is, she's also a nutrition coach. She's also a CrossFit coach. So for my moms and my moms-to-be, definitely we're probably going to have something in store for you guys with regards to fitness, postpartum, during pregnancy. So stay tuned for that. But to wrap up, it's really important that there are some things that you consider when dealing with any type of issues, let alone pelvic floor issues. You really, really want a trusted resource. Google is well known for its ability to diagnose everything as cancer, so you probably don't want Google, but you really want to do your research. If you don't know, then find somebody who does. Find somebody who can be a resource for you, that can point you in the direction you need to go. The other thing that we have to realize is you only get one body. And you've got to be able to invest in you and invest in your health. Don't just wish stuff away. Don't just assume that, oh, tomorrow it'll go away. Especially if you have not changed anything. You haven't changed lifestyle. You haven't changed diet. You haven't changed train of thought and mentality. You haven't changed any of the factors that possibly could affect whatever this issue is. You've really, really got to think about investing in you first. And investing in your health. Again, home, I know insurances are pretty new, but here, people have access to a lot of different clinicians, either with insurance, without insurance, whatever have you. Deductibles are so high nowadays, but you can find a clinician who will take care of you, who will support you. And if it means that you may have to pay out of pocket, then fine. But at the end of the day, think of what is the goal that you're trying to reach. Am I trying to get better, or am I trying to save a penny? Because saving a penny and cutting corners may not, also not help you either. Am I trying to lose weight, or am I trying to be on a diet? Am I trying to change my lifestyle, or am I just going through a fad? What is your end result? What is your goal?
Yeah.
And I think that's huge, and that's a great way to start looking at how all these things can affect not only you physically, but then socially and mentally and otherwise.
Yeah, and that's a good point in terms of ending. I think for me also, to add to your point, it's being mindful that we hurt in private, but we heal in public. And so psychosocially, you want to begin engaging in conversations with multiple people about some of the challenges that you're having with any type of health issues. And why I always advocate that for people is that you never know that the person next to you that you think has the perfect life may be going through the same challenges that you're going through, right? And so therefore, when you begin to talk and you get to hear solutions, then you can say, you know what? Maybe I can try this, or okay, you've tried this and you're getting these results. Maybe I can go to your doctor. Or, you know what, you have tried this and it hasn't worked, but it doesn't mean that it won't work for me, but I'm aware of how it's impacted you, how it's impacted your health. And I think a lot of people's mental illnesses occur because of isolation. We choose not to have a conversation about things that happen to people every day. All women, we got vaginas. This is not a secret. We all have pelvises. These things are not secret things that we have been taught. And so by extension, because we're taught that these things are so sacred, we forget that everybody can actually be experiencing the same thing, and we don't actually have to suffer in silence. So for me, that's my biggest thing. It's like, reach out, find a group, and I always tell people there are resources. There is whether or not you want to go. It's like shopping for that perfect dress. It's out there, but you can't go to 2 stores and say you want to find the dress. You might go online, you might have to get somebody make the dress, but the point is the dress that you want to wear is out there. And I think that's the same thing when we address our bodies. Our solutions are out there. We just need to make sure that we're stepping outside of our comfort zones or what we're taught about isolation in our health issues and get some kind of creative solution to the problems, or just information, because information is useful for productivity.
Absolutely. Well, thank you so much. Hey, Tony. Thank you so much for jumping on and doing this. Like I said, everybody, we're probably going to be doing a part 2. And, I'm even considering we might need to make this like a monthly thing, like a mental health wellness focus, where we even have like a discussion, have some community, that type of stuff. So, whatever gets the information out there, because the information is there. Yeah. It's there. So if anybody needs to get in touch with you, Janelle, how would they do that?
They just follow me on either my IG or my Facebook at JayceeMayers, JayceeMayers. And from there, I can always contact them via phone or whatever the case may be. Yeah.
All right, and you guys know I'm Dr. Joanne Michelle Martin. Everybody calls me Jay. You know, you can direct message me on the Facebook page, JMM Health Solutions. Instagram handle is the same thing, at JMM Health Solutions. I'll put the information there for you guys so you have it. But if you guys have any questions at all, please do not hesitate to reach out, because like we said before, you know, the information is there, the resources are there, and nobody should have to suffer in silence because they feel as though they cannot be helped. So I want to thank you guys for your time. We went over an hour.
Yeah, you see?
It's good stuff. Right? But we want to thank you guys for your time. Thank you for bearing with me with the tech issues. I promise y'all I'm going to get a new phone. I promise. But thank you again, and we will be keeping you posted and updated on when we'll be doing another one of these sessions. So we look forward to having you all here, and have a great night and happy weekend.
Thank you. Bye, Drew.
All right, take care.
Bye, guys.